Number of conditions that bother males is normally not very high, but of late we are seeing that applications or indications for which males have now started approaching us are now on the rise. And gynecomastia or man boobs, as supposedly very popularly they are known as, has become a major concern now. And the incidence of this seems to be going up quite a bit. And month on month we are seeing that more number of people are coming forward and trying to seek treatment for this condition. We know everything about it. We know why it happens, in whom it happens, what needs to be done for it. And surprisingly, even those who are suffering from it know it. जिनको ये तकलीफ है वो जानते हैं कि उनको क्या प्रॉब्लम है, उसकी वजह से उनको क्या क्या इश्यूज आ रही हैं, क्योंकि गूगल पे आजकल सब इंफॉर्मेशन अवेलेबल है. लेकिन what is interesting is that there is a lot of disconnect between the person who's having this problem and his parents, disconnect between the parents and their information and their role in the whole process. There is disconnect between the family and the service providers जो इसके लिए treatment offer कर सकते हैं. So we approach it in a different way. We treat the whole problem holistically. We look at the entire whole ecosystem which goes around this condition of so-called gynecomastia or man boobs. We as a system, we look into the cause. We try and get into the homes of these patients to find out what are the factors which have led to the occurrence of this condition. We look into the dialogue between the patient and their parents, because that's where one of the disconnects is. So we become the intermediary. We hear the person who's suffering from this and we tell the parents of what the person thinks. We tell the patient of what his parents think. We address their concerns and their issues and we try and resolve them so that all of us come on the same page and we can move forward constructively. So we look into the cause factors, we look into the body factors, we look into what has caused this problem, what are the existing problems which may still be of concern. And when we do this procedure, how the recovery is going to be, how soon or late it is going to be, what it is going to do to the person who is going to seek this treatment. Does he himself even know why he is looking for this? Is it only out of peer pressure? Is it a genuine advantage that is looking at when he undergoes this procedure? So we analyze all this and we arrive at a situation where we optimize the entire ecosystem. We optimize the patient, we optimize his parents and family and their relationships. We optimize our own department and our own team into addressing that patient. And it may take time. It might take a few time to optimize this whole situation so that when we do the procedure, then it's the quickest outcome, it's the easiest outcome, it is the most successful outcome, and it is the best that the patient or the parents could have hoped for. Because at the end of the day, outcome is the most essential thing. And we have made that as one of the guiding principles of our department, that we are focused on the outcomes. And these outcomes must be fairly objectified and delineated and identified before we undertake the procedure, and that we are able to deliver on all the counts. So being outcome driven, I think, and approaching these subjects holistically and taking into account all the factors which go into that, addressing all the factors, is one of our main USPs in this department. We do thorough investigations. We look into the cause and effect relationship. We try and correct the cause so that the effects are minimized and in our favor. And we use this using the best of technology these days. We are using, under the present circumstances, we are also keeping safety as a primary concern. We ensure that the patient safety is not compromised, the attendant safety is not compromised, the department and the hospital safety is not compromised. And for this, we have worked out a technique or a method in which we minimize the number and occasions of physical contact. So we will see you, we will call you to the hospital only when it is most important. and hopefully they are only on 2 occasions when we need to finalize all the plans, and especially when we want to do the procedures themselves. I think we now have addressed almost all the concerns of the patients, and I'm happy to say that this kind of approach is helping the patients and their families to arrive at a certain level of comfort where they are happy to give us this responsibility of taking care of their problem, and we are happy to take care of this problem so that at the end of the day everybody is happy. So look forward to this opportunity, and we are there available for those people who might want to seek our help.